I thought I would not be doing my job as a nurse if I at least didn't offer my services.
Cheryl Hayes headed off into retirement in June 2019 when she left her post as the Vice President of Patient Care Services and Chief Nursing Officer at Kenmore Mercy Hospital. But the break turned out to be short-lived.
I thought, well, at least I could do is call somebody and see if they need help, and they did.
As New York dealt with the brunt of the pandemic last year, the state called for licensed retired healthcare workers to provide backup for hospitals. Before she knew it, Cheryl ended up back at Kenmore Mercy, a place she worked at for more than 20 years.
They called me in and asked me to help with their vaccines. I also helped with, back in the spring when COVID first started, help with St. Joe's with the staffing there, and I worked at the corporate office.
Cheryl coming out of retirement and returning to the front lines for one of her most challenging assignments of her career.
We've never experienced anything like this. We had the SARS years ago, but it was nothing like this, that you had to wear the mask, you had to keep the 6-foot distancing, you had the quarantine.
As we now approach the 1-year mark of the pandemic, Cheryl isn't letting up. We caught up with her Monday afternoon as she was administering the COVID-19 vaccine at a vaccine pod at Kenmore Mercy. For her, working with the patients keeps her motivated during what's been a strenuous year.
Just being able to see them, educate them, talk to them, and interact. Giving the injections only a small part of it, but being able to help the community at large. That's been very rewarding to me.
She tells us she has plans for the summer, so she hopes to wrap up in the spring, but she'll still offer her services if the need is still there.
I'm very glad I did this.
Brandon Lewis, Spectrum News.